Assalamu alaikum. So in this lecture we will discuss about a medical condition known as cholangitis. Cholangitis is the inflammation or infection of common biliary duct or say biliary duct, mainly due to as a complication of cholelithiasis, or simply is a complication of gallbladder stone which is now migrated to the biliary duct, and they cause inflammation, or there are some infection which can cause biliary infection, common biliary duct infection. In cholelithiasis or cholecystitis, we find patient have jaundice and right upper quadrant pain, but there was no fever. And in cholecystitis, the inflammation of gallbladder, patient presented with the right upper quadrant pain, but there was no jaundice, there was only fever. If patient have both of these things, the patient presented with the right upper quadrant pain, having fever and jaundice, then that is the Charcot triad. Charcot triad classically present it's the cholangitis. So what is cholangitis? Cholangitis is the inflammation of biliary duct or say common biliary duct. CBD. The inflammation of the common biliary duct. What are the causes of cholangitis? As a complication of cholelithiasis, stone in CBD, or infections. Most common infection of cholecystitis was E. coli. So most commonly it is caused by E. coli, Klebsiella. It can cause cholangitis. There is an infection. Now the most important thing is investigation and symptoms. To remember the symptoms, you should only remember two things. The first is Charcot triad, or you should remember Reynolds pentate. Pentate means 5 things, triad means 3 things. The 3 things are triad. First one is right upper quadrant pain. The second thing is patient presented with fever, and the third thing is patient will have jaundice. If these 3 things are fine in a patient, then that is a Charcot triad positive. And what is Raynaud pentate? Raynaud pentate is a Charcot plus patient will be in shock. Fourth thing is shock, plus fifth thing is patient will have altered state of consciousness. Patient presented with right upper quadrant pain is now having fever. Is investigation find patient is having jaundice, have altered state of consciousness, and is also in shock condition, in septic shock. That is a classical sign, or classically it is a clinically diagnosed patient of cholangitis. Now let's discuss it in investigations. What are the investigations for cholangitis? Best initial test is ultrasonography, and the most accurate test is ERCP. ERCP used both for diagnostic and treatment purposes. And the other investigation you should know is CBC On CBC you will find white blood cell raise. On LFTs you will find raise GGT and raise AST, ALP. On investigation you find GGT raised, ALP raised, and CBC white blood cells are there. And on clinically patient presented with fever and right upper quadrant pain, that clinically why it's the cholangitis case. Now treat it. The treatment of choice is ERCP. ERCP plus give IV fluids plus antibiotics plus NSAIDs. In both right upper quadrant pain, patient very in this condition really seen as a very toxic case. In toxic case, first you should reduce the inflammation, then do the surgical procedures like ERCP. So this is cholangitis.